So what is 3D printing and how it is making very ease in the orthopedic industry?
Right. So 3D printing is a new technology which has come in, and we are using it regularly. It started with, aviation industry. They used to do a lot of 3D printing to improve their aeroplanes.
Yes.
Nowadays we have 3D printers in our offices, where what we do is, suppose a person has a complex fracture of the knee, where we don't know how the anatomy is.
Yeah.
So what we can do is we can do a CT scan of the patient's knee, and we have special softwares where we can find how much the bone is broken, where it is broken, how to lift it up, how to fix it properly, 100% according to how the patient's anatomy should be. And we can also get the same model printed in our offices even before we have taken the patient to operation theatre.
Wow.
So what it does is, one, we are confident, we know what to do.
Yes.
Number two, we can order specific plates or whatever we need to fix that fracture.
Yes.
We can even make custom-made implants for that patient. So it is not one size fits all. So according to the patient need, we can print that specific plate. Number four, we are going in the operation, we are using less time. So patient is under anesthesia for lesser time.
Yes.
There is lesser blood loss.
Exactly.
And the most important thing is, we can explain to the patient what is going to happen to you
Before
on the same model which the patient, on the patient's own anatomy.
Yes, exactly.
And now if we talk about, because we are doing a lot of teaching and research, so what we can also do is, we can teach our colleagues, we can teach our juniors. So everybody is on the same page when we take the patient for the operation. So
yes,
very good results, functional outcome is good, patient can move very fast, early recovery, win-win for everybody.
And there's less chance of any human error also.